As a GYN only practitioner in our office, probably 80% of my patient load is made of women in their 40s. The most common complaint is abnormal bleeding, hot flashes, weight changes, mood swings. And honestly, this sounds very much like all the other groups that I've talked about. But at this point, we sort of have to look at a new player called perimenopause. I still will find many patients with other disorders such as diabetes and thyroid. In fact, I would say my most common age range that I diagnose thyroid problems is in the 40s because the symptoms are almost exactly the same as menopause. You have weight complaints and irregular bleeding. You're going to get a thyroid test, and you're probably going to get a test to rule out diabetes as well. And perimenopause is a diagnosis of exclusion because we can test for thyroid and diabetes, and everyone assumes you can test hormones and find out if you're in perimenopause. But the problem is the cause of all these symptoms in perimenopause are the hormone fluctuations. And the truth is you could test somebody's hormones one day and test them the next day and they look totally different. So it's very confusing, and checking the hormones actually is not always the most efficient way to make that diagnosis. A lot of patients come in and they expect their hormones to be checked. I feel like sometimes some are disappointed because they're not. But after you explain why, then they usually understand why we're not always checking them.